Okay, this week's topic is postpartum hemorrhage. So that can be defined as postpartum bleeding when a mother loses more than 500 mLs of blood after a vaginal birth, or more than 1,000 mLs of blood after a cesarean birth. Um, Two complications that can occur from postpartum hemorrhage are hypovolemic shock and anemia. Some risk factors. So someone that would be at risk for a hemorrhage, someone that has an overdistended uterus, a history of prolonged labor, oxytocin-induced labor, a ruptured uterus, placenta previa, abrupto placentae, precipitous delivery, lacerations, hematomas, someone that may have mother that may have retained placental fragments. The woman, when she's hemorrhaging, is going to present with clots larger than a quarter size. She will have a boggy uterus, so the uterus will not be, firm. It'll be like spongy, squishy on palpation. She'll present with tachycardia and hypotension. She'll feel pale, clammy, and she'll have cool skin. So our nursing to-do list, the number one intervention that we can do as nurses is we want to make sure that we massage that fundus. We really want to make sure that the fundus starts to contract and harden and firm up. We'll also administer uterine stimulant meds to help with the firming of the uterus and to help it contract and firm up and to get rid of the bogginess. Meds like oxytocin, excuse me. We're also going to monitor vitals. We'll have to potentially put in a Foley catheter so we can assess for kidney function and obtain an accurate measurement of urinary output. We'll have to administer IV fluids to help offset that hypovolemia. We may even need to give blood products as well, like packed red blood cells and fresh frozen plasma. We'll want to give her oxygen 2 to 3 liters per minute. We'll want to elevate her legs to help with that circulation and bring the blood back to the center of the body. And then we'll want to, for her diet, once we get the hemorrhage under control, her diet will need to increase her iron intake. And iron is best absorbed when it's taken with vitamin C. So we'll want to make sure that she is increasing her vitamin C intake as well as protein. All right, that's a little bit on postpartum hemorrhage.